Welcome. You have chosen to use the DMPA-SC, also known as Family Planning Childbirth Spacing Injectable, that you can use yourself. In this video, you will learn how to give yourself the injection. You may have received an instruction sheet that can help you inject on your own. Be sure to review this and keep it handy. DMPA-SC is delivered in a small device. One injection will protect against pregnancy for 3 months. Store the device in a safe place away from children or animals and extreme heat or cold. The device has 4 main parts: the reservoir, which contains the drug, the port, a small needle, and a needle cap. To begin, wash your hands using soap and water. Then open the pouch and remove the device. Make sure it is not damaged or bent. You should also check the expiry date. Now, holding the device by the port, shake it for about 30 seconds until the liquid solution is mixed. If you do not inject right away, be sure to shake and mix again before you do inject. Check again to ensure there is no damage or leaking. If the device is damaged or the solution is not mixed, discard it and use a new one. Now, you are ready to activate the device so the liquid can come out. Hold the device by the port while pointing the needle up to prevent dripping. Then, push the needle cap into the port to close the gap. You should hear a slight click. Now you are ready to inject. Remove the needle cap. You can inject either in front of your thigh or your abdomen, avoiding the navel or any bony areas. With one hand, gently pinch your skin together and create a tent. With your other hand, hold the device by the port and insert the needle straight down into the tent. The port should touch the skin completely. That means the needle is inserted at the correct depth. Squeeze or press the reservoir slowly for about 7 seconds so most of the liquid comes out. It's okay if there is small amounts of liquid left. Remove the needle, then let go of the skin. Do not rub the injection site. Place the device in a puncture-proof container right away, close it, and store it in a safe location. At your convenience, bring the container to a facility or health worker so the devices can be disposed safely. Now, let's review the most important steps for self-injection. Shake the device for 30 seconds. Activate the device. Pinch your skin to create a tent. Squeeze the reservoir slowly for 7 seconds. Remember, each injection provides 3 months of protection from pregnancy. Make a note to remind yourself of the next injection in 3 months. Now, there is some additional information you should know. You are protected against pregnancy when you inject within 2 weeks before or 4 weeks after your scheduled injection date. If you don't inject on the scheduled date, mark the date when you actually gave yourself the injection. Then count ahead 3 months from your actual injection date. This date is now your next injection date. If you are more than 4 weeks after your scheduled injection date, you may not be protected from pregnancy. In this case, do not give yourself the injection. Contact a health worker or discuss your family planning childbirth spacing options. To avoid pregnancy, use condoms or do not have sex until you speak with a health worker. When using DMPA-SC, you might experience lack of monthly bleeding, heavy or irregular month bleeding, minor headaches, changes in mood or interest in sex, weight gain, abdominal pain or cramps. These are not usually something to worry about, but if you are concerned, contact a health worker. Also, remember that this injection does not protect against sexually transmitted infections like HIV. Always use condoms in addition to the injection to prevent sexually transmitted infections. If you have questions about side effects, prefer to have a health worker give your injection, or if you want to use family planning childbirth spacing option, then please contact a health worker who has been trained to offer self-injection information and services. Visit your nearest health facility for DMPA-SC, the family planning childbirth spacing option that you can use